Well, I always had an interest in science, and my dad was an internist, so he would come home to the kitchen table every night and tell stories about medical problems that he had faced. So I had a strong interest in medicine and science from an early age. I knew I was going to do something in science and thought I probably would be doing something in medicine when I went to college. When I eventually applied to medical school, I thought I was going to do internal medicine. That was my focus, that's what my dad had done. And then I went on my surgery rotation, and it was just amazing to me how in surgery you would see the problem you're addressing and fix it right there in front of your eyes, and then the patient got better, and that's what really drew me to surgery. I want to know this is a partnership, so I'm in this with them together from start to finish. A lot of times in general surgery we'll do quick procedures where maybe take out an appendix or take out a gallbladder, and you see them and then it's finished. But other times it's longer term issues like breast cancer, where I'll see the patient, they may not have their surgery for 3 months as they're undergoing other treatments, and then they have their surgery with me, and I'll see them for 3 months, 6 months, a year, years down the line. And I want them to know that it's a partnership, I'm here for them, and we'll get through it together. Two different types of pain management. There's the initial post-operative, very acute pain, and then the longer-term recovery type pain that we deal with. So in the initial post-operative pain, we do use injections at the time of surgery to kind of help with that initial few hours after surgery. But then we talk about the longer-term pain management, encountering days after surgery to maybe a week or two. We do our best to avoid narcotics. There are a lot of other options out there now that we use that are anti-inflammatory type medications, and do our best to use those to manage pain. And a lot of times, quite honestly, it actually works a lot better than narcotic use. Well, being from North Dakota, I like to snow and water ski, so snow ski in the winter months, water ski in the summer months. I have 3 girls that also do that, so they keep me busy. I also have a saxophone that's gathering a little bit of dust, but I try and get that out every now and then. Because the nights can be quite long in North Dakota, I got into astronomy. And so I have a couple telescopes that I'll drag out every now and then and look at the stars and look at the planets. And it's just amazing to me. It kind of expands your mind to what's out there. I would want them to know that I'm in this for them, and again, it's a collaboration between me and the patient, and if they have any concerns or questions or worries about what the treatment is, they can always reach me.